In fact, Bruce, the lawyer for the union representing about 150 school nurses tells me many have already resigned their positions because of the, quote, uncertainty of the pandemic and returning to in-person school.
We've lost parents.
Patricia Stamper
I've been very anxious all summer.
and Maya Baum are consumed with concern and questions about DC Public Schools and its preliminary plan to return to class in the fall, even if it's part-time.
Who's responsible for taking these temps? They sent us emails saying that the temperature can't be over 100.4.
And then what happens if somebody suddenly gets sick? Does that mean the entire school has to quarantine?
The two teachers were part of a coalition of educators who compiled a 4-page list of issues they say need to be addressed before they return to the classroom. Empower Ed, an education advocacy group in D.C., released the survey that included concerns from contact tracing to special needs students and those with social emotional challenges. Number one on the list, assurances that schools will have enough nurses.
It boggles my brain because I already know how this works.
School nurses are not DCPS employees. The health department contracts with Children's National Medical Center to hire school nurses. On its website, I counted at least 25 local job openings. Neither Children's nor the health department got back to me about those positions. However, the union says schools were short-staffed even before the pandemic. According to Walla Blage with the DC Nurses Association, quote, nurses were not working 40 hours a week at each school in violation of DC law. Teachers say some nurses split their time between schools.
They don't know the little nuances of this child.
Or if they even have a nurse. Sorry to interrupt, but we have schools in DC who don't have school nurses.
DC Public Schools insist they are getting feedback from parents and teachers and are moving forward with the guidance of the health department. But these teachers say it's the details of everyday instruction and life in a classroom that still need to be addressed and keep them up at night. Delia Gonsalves, WUSA 9.